Alexandra Sirota is the executive director of the Budget and Tax Center and has been a voice and a resource to the movement in the best sense of a advocate who listens to the movement and just really props it up and has built something really special with the Tax Center. And this is budget week, and so we are so lucky because I know Alexandra, she is being pulled in so many directions, but we are so lucky and grateful to have her join us this evening to talk about what's going on with the North Carolina budget. We hear a lot what's going on with the federal budget, and I'm sure that context will come up too. But we also want to make sure that we're tracking what's going on here in North Carolina. So with that said, Alexandra, welcome.
Thank you so much. Thank you so much for including me. It's a real honor to be in this work with you all. I've learned so much over the years through our partnership about what are the right questions to ask and what are the most important data to bring forward to support us in the fight for racial and economic justice in North Carolina and the country. And our organization really has focused on the ways in which our budget and tax policies can advance well-being, address poverty, and ensure that everyone has what they need. So, as Rob said, and as you all know, it's been a wild week, to say it mildly. And I did feel, given the time, that I wanted to weave together the updates on federal and state budget development because I think in this moment, so much of what's happening at the federal level is going to be forced down to the states to sort of deal with in various ways. And so I hope this gives you a picture of what is happening and ways that you can engage as well in the near term. So I will dive in. This is just a little bit about our organization. We are a nonprofit, nonpartisan organization. We have a vision for North Carolina where every person can reach their full potential and achieve well-being through the support of trustworthy anti-racist institutions and systems that we all participate in building. We very much see the opportunity to connect more people to the policy process as critical to moving the kind of economic agenda that isn't rigged for the already wealthy and well-off. So as I mentioned, budget and tax policy is really our core focus. Our feelings about this and our research into this really is grounded in the idea that people fuel the economy, that when inequality and hardship are widespread, it not only hurts people, it slows economic progress, and that we can make choices to achieve better outcomes for people so that they can live their best lives to their full potential. Federal funding, as I said, has been front and center right now. Federal funding in North Carolina provides almost the equivalent of our entire state budget every year. So, I wanted to focus on this because in the first 100 days, we saw significant cuts, funding freezes, and just general funding chaos that has a real impact on our state. Federal funding provides programs and services in 100 counties. It plays an important role in North Carolina in making sure we don't fall further behind other states in the country because it encourages the state to fund things that the state legislature might not fund. It creates conditions for businesses to start and expand, and it directly provides support to individual households and families. But the cuts that are being pursued right now at the congressional level, many of you likely saw the House budget bill passed this morning, will shift costs to states, hurt people's well-being, and block economic progress. And the reason I wanted to start with the federal cuts, and I'll spend most of my time on this in the rest of the presentation, even though honestly I feel deeply that the core reason we should be objecting and opposing the US House proposal is because of what it does to people's well-being. I'm going to talk specifically about the way that the federal cuts are shifting costs to states, because that then has an impact on the state budget that is being put forward as well right now in our state. So you've likely seen these headlines, billions of dollars in Medicaid cuts and food cuts to food assistance. These cuts are primarily focused on work reporting requirements, but they also increase the cost share that the state would have to pay, add new reporting requirements, and block the ability of the state to raise funds for particularly healthcare. People across North Carolina will be hurt directly and in broader ways. So we know that people will lose health insurance across the state. 375,000 are estimated to potentially lose food assistance. Healthcare premium costs will rise, a whole host of really harmful impacts on people, which will also impact in these communities the stability of rural hospitals, the stability of healthcare providers, of retailers, and so on. So when people are hurting, our entire economy is hurting. And I think the point about why this is happening is so important and can often get lost. This is happening because of the interest in extending the trunk tax cuts. These tax cuts provide the top 1%, $1.1 trillion. In North Carolina, the top 1% would receive $1.9 billion a year in tax breaks. And those numbers, that number at the national level roughly is equivalent to the cuts that are being proposed in SNAP and Medicaid. So the average tax cut for millionaires from this plan is 1,000 times the average tax cut for low-income households. So a significant shift in the costs to people by taking away healthcare and food assistance to pay for tax cuts for the very wealthy. But let me talk about what you wanted me to talk about, which is the cost shift or the North Carolina state budget and why these federal cuts right now are so difficult for our state to even contemplate. What is being proposed in the US House plan are cuts that would also push and force cut costs onto the North Carolina state budget. So one of those costs is, for the first time ever in the food assistance program, North Carolina would be required to pay a share of those costs. That's never happened in the 50-year history of the program. And that would mean $584 million a year. In addition, because of a provision that penalizes states who provide access to care for children and pregnant women who are here legally, the state would also likely receive an estimated $600 million in new costs to cover health care. At the same time, because they're shifting the cost share for North Carolina, that automatically ends Medicaid expansion in our state. We have a provision that will do that. The bill also adds new costs for administration of Medicaid and SNAP, cutting out federal funding for those administrative costs. So at the same time that they're adding new reporting requirements, more frequent determinations of eligibility, they are taking back funds that allow staff in these agencies to process those in a timely way. And now they'll have an even heavier workload. And then the last thing is that the federal government is blocking the use of healthcare provider taxes as a way to cover the state share. So there will be limits on the ability of the state to raise those taxes to cover the share of Medicaid. And so when these things happen and the state can't find the funding, we know that it will make even deeper cuts to eligibility and services and take not just from the areas of healthcare and food assistance, but from public schools, infrastructure, legal representation. A whole host of areas in the budget are likely, state budget, are likely to be impacted as budget writers try to find the funds to cover these new costs, because they don't have the money to cover the costs we currently have as a state. Because of, for more than a decade, North Carolina lawmakers have cut income taxes for the very wealthy and scheduled out those tax cuts into the future, including completely eliminating the corporate income tax by 2030. North Carolina, by the end, will have lost out on $13 billion in annual revenue. And that's about a third of our state budget. So as they're continuing to cut income taxes for the wealthy and profitable corporations, they're not only failing to keep up with existing current service needs, they're certainly in a difficult position to keep up, to take on more costs. We have a petition to call on our legislature to stop the corporate income tax elimination. You can see it here. I'll put the chat link in the chat when we stop, but anything you can do to help us get signatures. We are trying to demonstrate just how unpopular all of these policies are that give away our money to the wealthiest and profitable corporations. Oh, sorry, this slide looks a little messy. I'll fix it for you when I send it to you, Rob. But I wanted to talk about where we are in the state budget timeline, because as Rob mentioned, this week was sort of a critical week in both the federal side, but also the state side. So this week we saw the North Carolina House present its budget proposal. This is after we had seen the North Carolina Senate proposal get presented and passed. And but starting at the beginning sort of this process, the goal of our budget timeline is that state agencies create their budget, that they do this based on an assessment of the needs. Ideally, we would like to see them do this on the basis of public input. That happens usually in the late fall, early winter. And then by February, economists in the State Office of State Budget and Management and the Fiscal Research Division come together to agree on how much revenue we are going to collect in the next few years. That consensus revenue forecast for North Carolina came out in February, and it showed an alarming projection, which is that the state will not have revenue growth in the second year of their projection. Revenues will actually fall by $800 million, despite the fact that the economy is growing. And that is a direct reflection, and they said this, of the income tax cuts in statute. So as the income tax cuts play out, North Carolina is exactly going to displace the revenue we need to keep up with what we know is a growing cost of delivering services. I can stop. I see a hand raised. Sorry, I don't want to keep talking if there's a question. You can feel free to interrupt and ask questions.
So Peter Van Dorsten here. I just had a question on the consensus revenue forecast. With the action that's just been taken at the national level, does that get updated?
Yeah, so it's a really great question. We've been asking the same one. We are hearing that there could be a new version of the consensus revenue forecast in the next 2 weeks. I'm not sure how much it will take into account things like the impact of tariffs, the increasing likelihood that the economy is headed for a recession. But I think it will potentially have those factors considered. What it will also consider is some of the timing issues that are happening with revenue collections that have been more challenging in this chaotic environment. Any other pieces about this time? I can just name the next step is, the governor releases. We saw the governor put forward a proposal that paused all of the income tax cuts that are scheduled. This was a very important move to stop digging the hole that we're in. Our argument would be we need to start, raising taxes on higher incomes and on profitable corporations, but stopping is certainly an incredibly important step at this moment. And the governor's budget also included some targeted tax credits to workers with low wages, an earned income tax credit that was quite generous, about $1,000 on average per person relative to what I'll share the House had. That's an important point. So this is the timeline. We are at a critical moment in that we have now all three proposals, the governor, the Senate, the House. The Senate and House proposals are far apart. Now there will be likely a conference committee appointed, and negotiations will begin between Senate and House leadership. Every expectation is that it won't be done by the end of June, that it will take some time. And to the question, the federal context is going to matter a lot because, again, depending on where the congressional budget plans land, the state budget will have to make some really difficult decisions about what they fund and what they don't fund. So I just want to walk through the two proposals to give you some more information. The North Carolina Senate budget proposal is unacceptable. It maintains the scheduled elimination of the corporate income tax. It deepens cuts to the personal income tax that benefit the richest 1%. And it pays for these tax cuts by keeping overall spending at record low levels. It fundamentally keeps in place a situation in which not only will we not be able to keep up with current service levels or address things like the obligation to provide every child a sound basic education, we will not be able to address the federal costs and be less ready for a possible recession. So you can see what the benefit is from the Senate tax plan when it goes fully into effect. This is the top 1%. So these folks on average have incomes of $1 million in North Carolina, would get an additional, this is an additional tax break of $3,600, whereas the worst paid North Carolinians would receive just $5,000. So a completely unacceptable upside down tax proposal from the Senate. On the House side, the House is not all that different. I think the reporting on this has been a little bit inaccurate to say that they're so far apart. The House budget continues with the same income tax cutting agenda. It maintains the scheduled elimination of corporate income tax. What it does do is make sure that the personal income tax cuts in the future don't happen unless a higher revenue threshold is met. This is good in the sense that it will make sure that we can keep up with some of the costs that we're likely to have given current service levels. But again, it leaves us unprepared for cost shifts. It continues record-breaking low spending. And interestingly, I think it recognizes and a lot of the legislators talked about the issue of raising costs for family, the need to address that, but it uses gimmicks rather than meaningful relief. So one of the gimmicks you may have read about is a $5,000 tax exemption for tipped wages. They're using the number $5,000, but the actual tax reduction is only $200. And again, you heard me say Governor Stein was providing almost $1,000 tax credit to all working families with low wages, regardless of how they earn their income. The tipped income exemption likely only reaches less than 5% of North Carolina workers. So again, the House budget proposal keeps spending at a 50-year low. And this graph we show because it really does tell the story of significant declines in the state's commitment to funding opportunity in our community since the Great Recession, and since tax cuts became the primary agenda of the leadership in the General Assembly. Again, the idea of trickle-down economics has gotten its hold, and everything we can do to really demonstrate that it's people who fuel the economy, and it's making sure that people have what they need that's going to advance the well-being and the long-term sustainability of economic opportunity in our state. These are some ways to engage. We have real-time updates on budgets that you can sign up for. We have flyers and yard signs that you can request. I mentioned our petition, and we're developing a letter to the editor toolkit in case there's anyone here who might be willing to help get the word out about the state budget. And again, our hope in the final budget conversation is to ensure that the income tax cuts are stopped so that the state can fund the things that we know matter for families: childcare, healthcare, food assistance, housing. And I think that's my last slide, so I'll stop there. And I'm happy to open it up and answer any questions.
That was a great economy of words. I can't believe you did that much work in that little time.
Sorry, I hope I didn't go too fast.
No, that was incredible.
That was
Hold up,
great.
we're going to go through and do comments and questions in a relatively organized way. And maybe we can make sure everyone definitely that real time, I will say, updates are great. I just signed up for it, so make sure that you sign up for those. And
What was the address again? She just had it. You took
Sorry,
it down.
we can put it in the chat too.
Okay.
I'll do that.
And also that petition is something that we want to put out every meeting we go to. I'm going to email Danny to get a yard sign because that is it's a really wonderful campaign to say, you know, it's hard to argue. Anyone you tell that we're about to make corporate income tax zero,
yeah,
like that, the Chamber of Commerce, the North Carolina Chamber of Commerce, which is awful, they didn't even ask for it. They said it says low because we already had the lowest in the country of states that have that tax. So it's a wonderful campaign to help bring people into this. If folks would put their, because I know there's a lot of questions, and if you can't put it in the chat, then we're definitely gonna have some spoken questions as well and some discussion here. But it'd probably be helpful for everyone if you're able to put in the chat so that we can kind of think them through. My two clarifications, because I'm not going to do what I just said, but my two clarifications that were really powerful, what you said. The first one was that the current U.S. House budget does, because we have a trigger law in North Carolina. I had heard in previous meetings that this budget did not do the trigger, but you're saying that it probably does. So that's the first one. And then the second one is that the House budget, that was so enlightening, the North Carolina House budget, because they are praising it like it's, you know, some progressive thing. And over half the Democrats in the NC House voted for that budget. And so we need some collective clarity about that budget, but specifically the gimmicks thing is important. I know we have Emma on here and many of us who are around the childcare, so I'd love to hear about the childcare piece. And then that I had thought that and this is my confusion, that they had delayed the corporate tax cuts as well, but it's not, it's just the income. Okay. So those two questions to start us off, and then others, please chime in after we get a little response to that.
Yeah, so this is now confirmed. The way that the House budget moved through the Rules Committee, it did not penalize North Carolina at the beginning. It was originally only going to reduce the cost share for the federal cost share for Medicaid for states that use their own money to cover people without documentation. They then, in rules on Tuesday night, it's pretty blurry for me right now, but I think it was Tuesday night, added an amendment that expanded that to include any state that has elected to cover young children and pregnant people with health insurance coverage. These are folks who are legally residing here, and the budget would then, so they would reduce the cost share from the federal government for states like ours that does do that, and 30 other states, I believe, in the country do that, from 90 to 80% cost share. Any reduction in the cost share for the Medicaid expansion in our state, as you know, triggers an end to the Medicaid expansion.
And
So
just to put an underline under that people might know that that's the law. We passed Medicaid expansion way too late, but in that law was this trigger that if the federal government ever reduced the percentage of their care, then it would end Medicaid expansion in North Carolina.
Which means a lot of people are going to die.
yeah,
Yeah.
I mean, it's horrible.
We're talking thousands.
Yeah. And I think the thing we have to keep saying is really saying the why out loud. Why are they doing this? Why are they doing this now? It's to fund the tax cuts for the very wealthiest people in this country, the top 1%. So again, I think a lot of times it's presented as we have to do this thing. We actually don't have to cut these things. We could not extend tax cuts that haven't helped our economy and have only enriched the very rich. So that's one thing. And we still don't fully, frankly, understand the implications on the dollar amount. My $600 million number is kind of back of the envelope. So we're not sure what the cost would be to the state. Again, the impact would be the state would then have to make a decision. Do we make up for this cost? Do we try and cover the folks that are in the coverage gap, again, back in the coverage gap? And how do we do that? And as we all know, that's a very difficult proposition, particularly when we have our own tax cuts. The other question you had was about childcare. Was that right, Rob?
Yeah, on the North Carolina House budget, curious, and you said it clear that they did not end or delay any of the corporate taxes,
right.
But also just in general, how bad it is, what our messaging should be about it, and specifically about childcare, what's going on with that.
Yeah, so childcare has been an interesting issue, as you probably follow. So I'm going to try and think through how to talk about this. So the Senate bill really didn't put much into childcare. So about what is needed to make up for the loss of federal COVID era federal funding was about $230 million. We did not see that full amount. And in the House budget, the way they delivered the increase was using, I believe, 2023 subsidy rates. So I need to go back and look at that, but I'll get you the exact information. What we've been also asking for is not just to put more money in and to make it reflective of what it actually costs to deliver services today, but to make sure that there's a floor for all providers. Because right now in the system, depending on where you are located and what type of provider you are, you have a different floor. But what we know is that all providers need to have a base. Oh, great. Emma knows.
Yeah, Emma, come on and answer.
Yeah, please, Emma. 2023.
Hey, yeah,
That's what I thought.
I've been following that really close. They
Yeah.
are proposing to bring our subsidy rates up to what childcare costed in 2023, which is still far behind where it is now. And like you said, there is a difference in county to county. Although if I'm a five-star center, and another five-star center in Cabarrus County has to have the same regulations that I have, but they may get paid more or less. And so we have been asking for the statewide floor. But the two things that has really upset me about that I want to take a trip back to Raleigh for is the one, they do not include any funding to support educators,
Right.
you know, and so that ended in March.
Yep.
And so they're not proposing any funding to help support educators. And the second thing, they're actually looking to decouple the QRS system.
Yeah.
And that is really horrific in itself because we're already short staffed. And if you've ever worked in childcare and you or have children in childcare, 10 babies is a lot for 2 teachers. They're proposing that now we can have 15 children in a classroom, infants, with 3 teachers. And toddlers is looking to go up from 2 teachers to 12 to 3 teachers to 18. And the numbers keep rising. And that is so unsafe.
Yeah.
And it is so heartbreaking to see that they wanted to couple. Now, there are a few things with the QRS that I don't agree with. However, you know, we've always been in really good standings by being one of the top states to implement a high quality childcare system.
Mm-hmm.
And to see them wanting to decouple these regulations and throw more babies into a classroom is not safe at all. And they think that that's just the answer. So that is very disheartening right now, what they're trying to pass. So
Yeah.
that's all I had to add.
No, so helpful. Thank you so much for sharing that.
much.
And on the help to educators, I think it's really important to say it's both wages, and they were asked to also make sure that childcare educators could also pay childcare costs for their own kids and put money into a program that would allow that to happen, and they didn't do it.
That is
So.
okay.
Emma, yeah, we're gonna have to go back to Raleigh.
We gonna have to, yes. Yes. I'm
And,
ready.
I'll just not just because you have to laugh, not to cry sometimes. But I almost protested when they cut. You know, during COVID, they didn't let us inside the daycare. We just had to drop them off.
Mhm.
And now we have to take the kids in, and I want to go back to COVID because it's wild in there.
It is.
And I can't imagine you add 6 more kids to that. That is just ungodly. Evan, I see your hand up.
Yeah, I was wondering if you could speak to what's in the budget regarding hurricane relief. I know that originally the thought was to build it into the budget, and maybe there's going to be a separate relief bill. But one of the things that we're experiencing out here in Western North Carolina is all of the municipalities, there's been no significant funding. And so all the municipalities have been having to front the bill for the relief. And we're facing huge budget deficits, revenue deficits, impact to, our revenue comes from tourism, and we have had a reduction in tourism. So like our local county, mid-year cut 300 million from the schools and are like not willing to raise taxes enough to actually fund schools. So we're gonna have future cuts in jobs and teachers and on already stressed school systems. There's also going to be huge cuts in early childhood education. Just has it, and so these are all communities that already, most of these counties have higher rates of child poverty, higher rates of poverty than the rest of the state. They're going to have this hurricane relief issue and then all these other things happening on top of it. So I'm just kind of wondering what you know, Alexandra, about hurricane relief.
And Evan, do you mind just adding your second question that was in the chat too, just so we can get a twofer?
Yeah, I also put in, I've been hearing a lot about rebasing of Medicaid, like and that like it's a required thing, and just like it's gonna cause more cuts than just Medicaid expansion, right?
Yeah, so to the first question around Helene, so they separated the Helene package from the budget, and they passed the Helene package today in the House, NC House. I have a little analysis I can read from, but the top line, some of the things we like about it is it actually for the first time provides small business grants to businesses that are not able to take on loans right now, could reopen, add jobs back into the region, but have really struggled to get insurance claims filled and so on. So it provides grants rather than loans, which we've been really advocating for. It does not, to your question, provide local government revenue replacement, which was something that we wanted to see for exactly the reasons that you mentioned. I believe that the governor released his plan earlier and had a provision for that in there, and I imagine that there will continue to be conversations about it. What they did fund for local governments is a $50 million capital grant program. So that's likely mostly going to help with rebuilding infrastructure and taking some of the costs off. So far from what is needed to support local governments. And I think one of the things I'm trying to talk more and more about is the costs are the costs, and how we pay for it. We can make decisions all the time about how we're going to pay for it, but there's fundamentally costs that we have to figure out how to pay for. And what's been happening is the feds are now pushing the costs down to the states. The states for years have been pushing the costs to the locals. And in all of those instances, the people are left to hold the costs for all of this. And if we could break through and make it clear that if everybody paid what they owe, including the wealthy and big corporations, we could actually fund all these things and live in communities that are thriving. On the Medicaid rebase question, so Medicaid rebase is something they do every year, usually not every year necessarily, but when they put together a budget, they project how much the Medicaid population will grow and what the cost of that will be. And based on those projections, they budget for how much they'll put into the program, but sometimes they come up short. There are more people receiving services through Medicaid, or costs for Medicaid services change, and they have to adjust. And that's what the rebase does. And so when they don't fund the rebase, the Medicaid program has to either cut services or cut eligibility.
So we have a few more minutes. I'm going to combine Fleming's question, Reverend Brother Elameen's question and Attorney Millett's question. So first one is, can you comment on the impact of Social Security cuts on North Carolina? And then Keisha asked, could you talk about the impacts on SNAP and other food access programs from the federal state budget or state budget?
Yeah, so the Social Security cuts right now that we know about are staffing cuts and office closures. And so the impact of that's what we know about. But I think we should be clear that when you cut staff and when you cut offices, you're cutting the timeliness of the delivery of Social Security benefits. You're cutting access to someone who can help answer questions, get applications through, make changes in your Social Security. So those are the impacts. There are 4 offices that have been identified for closure. What we've heard is that in some instances, because of that, folks could be forced to drive more than an hour to visit a Social Security office. So there's one in Eastern NC, one in Western NC, and then in Charlotte, I believe, in Greensboro. They have not, as far as I know, I don't know, I haven't followed it this week, I got to be honest. I don't think they've actually closed yet. But I know we've talked a lot with workers in the Social Security offices in North Carolina, and they're overwhelmed by the amount of work they have given the staffing cuts they've experienced. And there's a lot of this is happening across federal agencies, but a lot of disruption to normal everyday activities are being disrupted by the funding freezes, the lack of clarity about what has been frozen, what hasn't, what can still be done, what can't still be done, who's in charge, and so on. So the other one was the SNAP cuts. So the way in which the SNAP cuts will play out is that they will, and this is gonna, hopefully I can trace this through in a way. I'm like a visual person. I told Rob I have to use slides because it helps me like break down my thoughts. But the SNAP cuts are twofold. I talked about there are three main ways they're cutting SNAP. One is the administrative costs. They're reducing the administrative costs that they cover by 75% in North Carolina. So the state would have to come up with 75% of the costs for staffing of SNAP. They are shifting the cost share for the first time ever. It's always been a federally funded benefit, but now they're asking the states to take on that cost, and the cost depends on the error rate. So they're cutting the cost of staffing to deliver more quality services. And if your error rate goes up, then you're going to have to pay more of the SNAP benefits. So that's one interesting design there, which I think gets at the thinking of let's design a system that doesn't work and reduces services. But the big issue that I think we don't talk about enough about the SNAP work reporting requirements they're putting in place. For the first time, they will require work reporting for families with children in the house, young children in the household. There've always been really strict work reporting requirements for working age adults, but now if there's and exemptions for families with children in the households, the idea being we want children to have food. Those cuts will mean that if people lose access to food assistance through SNAP, it also reduces the number of students in a K through 12 school who have access to free and reduced lunch, because the free and reduced lunch programs like community eligibility are dependent on the size of the population that's eligible for SNAP. So it has this on effect that's really important to tease out, because it means that kids will be hungry at home and hungry at school when we have design systems that can provide food for children and families. So that's the other way that will work. It also adds a work reporting requirement for people age 54 to 65, which we haven't had. And the reason we haven't had that is it's well documented that there's labor discrimination and for that population to get back to work, and a recognition that work reporting requirements might not be able to be met given those labor market conditions. Now they are back on the table in the House budget.